Thank you all. We're just waiting for a couple more for quorum.
Hi, Matthew. Hi, Marshall. Hi, Matt.
Good afternoon.
Hi, everyone.
Hello.
For those of you who just joined us, we're just waiting to establish quorum. I think we need 2 more if I can see everyone.
We just need one more.
1 more? Okay. Oh, I didn't count myself.
Chantel, perhaps if you could reach out to those who responded that they were coming and just ask them just send them a quick email or phone call to see if they're still able to come, please.
Sure, I'll go ahead and do that.
Great, thank you.
I'm
very
reaching
much.
out to Jackie right now.
I think we know Jackie is not able to attend.
Well, never
Jackie's
mind.
unable to attend or send a proxy.
Okay. Bruce? I spoke to Bruce this morning. I know he is coming.
I'll reach out to Bruce. This is Rachel.
Okay, thanks, Rachel.
He's joining right now, guys. Sorry.
Perfect.
All right, Ryan, with that. Oh, did he just drop off? I think Bruce just dropped off.
There's Joan. And Bruce.
Great.
Hi, Joan.
Hi, I'm here. Hi.
Bruce is still, hi, Bruce. All right, with that, we have established quorum, so I'm going to go ahead and get the meeting started. So good afternoon, everyone. With a quorum present, the Maricopa Regional Continuum of Care Board meeting is now called to order. A few housekeeping announcements. Please remember to mute when you're not speaking to create a positive experience for everyone. Members attending by phone only, please remember to press *6 mute and unmute *9 to raise your hand. Next, I'd like to welcome Chris Hallett from the city of Peoria as the newest member of the Continuum board. Chris, can you give us a wave? I don't know if I could see everyone. Did you wave? Perfect. Hi, Chris. So good to see you and have you here. We're all really excited to have you on board. I'm sure you're going to hear that from the rest of the board as well. I'd also like to welcome MAG's new Human Services Director, Kelly Williams. Kelly, are you out there? I saw you. There's Kelly. Wave, Kelly. Yay. Hi, Kelly. Welcome aboard. We're also happy to have you as well. And also back with us is Katie Gentry as the new Human Services Planner too, and she will be coordinating our board meetings moving forward. Katie, you want to give us a wave? I don't see you waving, Katie. Yay, there's Katie. All right, so welcome back aboard, Katie. The next item on the agenda is a call to the audience. Actually, I feel like I'm missing something, staff. Did we miss the roll call? Did I miss it? No, or is this first?
Since we have a quorum, we can go ahead and start with call to the audience. now.
Okay, thank you. The next item on the agenda is call to the audience. Members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within an hour of the posted time for the meeting. MAG staff, were there any comments received?
Yes, Chair, we received 2 public comments. The first is from Jennifer Dangermond. I will read it now. As previous co-chair of the Data Subcommittee and now as a community advocate, I'd like to thank CRN and MAG staff for their work to develop the system flow, tabloids dashboard, and PSH dashboards. This work has been needed for a long time. I am hopeful these data sets can become the basis for making data-informed decisions specific to the strategies in the regional plan to end homelessness. To assist in that effort, I am hopeful, number 1, the data is easily available to all members of the COC board, committee, subcommittees, and work groups. Number 2, review of the data occurs on at least a quarterly basis at board, committee, subcommittees, and work groups. Number 3, at each review, data is also presented by race to foster the interventions needed to address racial disparities in homelessness. Number 4, the public is provided with the data and a thoughtful analysis. Number 5, lastly, the data is also used as the basis to support policy changes needed to end homelessness. Thank you. The second public comment is from Amy Schwabenlander. I will read it now. Thank you for accepting written public comments. Until meetings reconvene in person, I request the COC board create a more interactive process for public interaction. Other entities following public meeting protocols have found ways to do this. I have several questions. On item 5, does the systems flow dashboard connect to and support the regional plan? Is this an update on behalf of the regional collaborative or just MAG? Where do we access information on the full collaborative? What is MAG Regional Council approving and why? What is the COC board going to approve and take action on? On item 7, what is the status of adding COC board members and what are the open seats? What is the status of applying for the coordinated entry equity demonstration? What is the timeline for the NOFO? Thank you for your inclusion of these questions.
Thanks, Jennifer and Amy. I'm really glad that we're getting some feedback, and I acknowledge your request to make our system more transparent. Am I correct, staff, that we cannot really address these questions at the moment, but we can address them either in a presentation item that's about what they have asked, or we can put them on a future agenda? Is that correct?
Madam Chair, yes, we're happy to address those comments as they relate to topics that are on the agenda for today, and any items that are not on the agenda for today will be considered for a future meeting, and we'll be sure to follow up with Amy Schwabenlander in regard to her questions. Thank you.
Okay, thank you very much. And again, Jennifer and Amy, thanks for sending in your questions and comments. I really appreciate that. So now we'll move on to our next agenda item, which is our next item is approval of the July 26, 2021 meeting minutes. Does any member of the board have questions or comments on the minutes? I don't see any hands up. I'm juggling screens real quick here, everybody. Let me put you on this screen. Okay. I've solved my screen issues. Okay. Seeing no questions or comments, could I have a motion to approve the July 26, 2021 Maricopa Regional Continuum of Care Board meeting minutes?
So moved.
Thank you, Bruce. May I have a second?
This is Joan. I second.
Thanks so much, Joan. We have a first and a second. Is there any discussion? All right, seeing none, I will ask MAG staff to proceed with the roll call vote. Please indicate clearly how you vote, stating yay or nay after your name is called.
I'll begin with you, Chair Ryan Balch. How do you vote?
Yay.
Thank you. Eric Cole. Is Eric Cole here? I don't see him. He's running a little bit late. Elizabeth DaCosta.
Aye.
Thank you. Marshall Franklin.
Aye.
Thanks, Marshall. Tad Gary.
Yay.
Thanks, Tad. Chris Hallett. I heard or I saw him.
Me?
Yes, I heard you. Yes. Thanks, Chris. Bruce Liggett.
Aye.
Thanks, Bruce. Joan Service.
Aye.
Thanks, Joan. Charles Sullivan.
Aye.
Thanks, Charles. And Jackie Taylor. I don't think she's with us right now. Jackie? No. All right, the motion passes.
All right, perfect. Thank you, everyone. And before we go on, I'm just going to take a quick point of privilege. Is that what it's called? Point of privilege. I just want to, we didn't really, in my introductory comments, I feel like we didn't really get to welcome Chris appropriately. So I just wanted to say, welcome, Chris. And I wanted to give any other board members an opportunity. And I also, Chris, if you wouldn't mind, if you could just say a little bit about yourself so our all of our colleagues out there have a better understanding of who you are and your goals in serving on the board.
Sure, thank you. First, I want to thank you all for allowing me to participate alongside you. I have been paying very close attention. I've been on the YouTube side of these for a number of months, so I appreciate all the comments previous and all the hard work you're all doing. I've been applying for this position ever since I've been over here in Peoria, which has been the last 3 years. However, I was employed with City of Phoenix for 26 years, so I'm very advocate of everything we're doing here. Been working very closely with many of the faces on the screen here and names over the years. So I'm very excited to have the opportunity to contribute as a West Valley City. We do appreciate the opportunity to participate and have a seat at the table. I think that's going to be very good for the region as a whole. I am meeting with my counterparts out here regularly. I've asked them to check me, make sure I'm representing them well, so we do pre-meetings and post-meetings. In fact, we have Amy coming to our next gathering because I think it's important that we stay in tune and on the same page. So very excited to actually put into practice some of the things I've been preaching out on this side as a bureaucrat, and want to be able to participate at a policy level with you all and look forward to it. Thank you.
Thank you so much, Chris. That was really helpful. Did any of the other board members want to make a comment? Just shout them out.
Welcome, Chris, and it's great to have you. And with the networking you have on the west side of the valley, it's going to be really important to our work and thinking regionally. So thank you. And these are not easy commitments to make. To be on the COC board, it's a lot of work.
Yeah. Looking.
Anyone else? All right, well, I'm thrilled to have you, Chris. I'm really thrilled to have the West Side represented so well, and it'll absolutely make a huge difference for our regional efforts. So thank you. All right, moving on to the next item. Stephanie Crum with Solari will provide a presentation of the system flow dashboard, and the board will have the opportunity to vote on how this information can be utilized and shared. I had the opportunity to view this recently, and I am blown away by the work that Solari has done, and I'm so excited to be rolling this out publicly. This is such an advance for our system, so I'm super excited about this presentation. So Stephanie, take it away.
Stephanie, you might be on mute still. We're not able to hear you if you're talking.
All right, can anybody hear me now?
Yes,
Oh,
thank you.
I am so sorry the microphone had come unplugged. I'm so sorry. Thank you all for having me. I'm very excited to present on this dashboard. I didn't know if TJ had wanted to give a brief overview first, and then we'll get into the demo.
Yeah, absolutely. I'll just provide a little context and let everyone know kind of what to be thinking about as you review. There's a lot of information that's about to be shared with you. It's all great, but it is a lot. So there are actions requested at the end of this, and that really is, as a community, the recommendations from the data and subcommittee and the committee are listed in the agenda, but I'll review them now really quickly so everybody's clear. So one is that this system flow dashboard is really shifted into our main arsenal for describing what is going on in homelessness, not to completely dismiss the PIT and the point in time count and its value, but to add this as the primary talking point because it is more up to date. It is an active month to month showing the inflow, active and outflow of our system. And so one of the recommendations is that this is used more prominently to describe homelessness in our community versus solely referencing the point in time count. And then the second piece, the committee and subcommittee and the data subcommittee were requesting that this not actually be completely publicly visible, but that it is visible to all COC related committees, subcommittees, and work groups, and that MAG would work in collaboration with the data subcommittee and the HMIS team to develop quarterly synthesis or synopsis of the data to provide an interpretation of what it means. And as Stephanie describes it, you'll see that there's a lot of detail there and a lot of it has technical definitions. And so it is not in the spirit of trying to withhold information. It's simply in the spirit of trying to ensure that whoever is reviewing the details of this has an accurate interpretation of it based on all of the technicalities within. So with that, I'll pass it over to Stephanie to actually review the dashboard with you all, but keep those two things in mind because that is the action requested of the board following the presentation.
All right, awesome. Thank you, TJ. Let me start sharing my screen here real quickly. Okay. All right, can everybody see that okay? We're good? Okay. All right, awesome. So when you come to the dashboard, when you first get here, there is a landing page. And this is really just an overview and a lot of the definitions, right? At the top of the page, as TJ was saying, there is a disclaimer. It is asking that the dashboard not be shared for general public use, but that it be reviewed with both Solari and MAG. Then we get into more of the definitions here on the first page. So what this means right here is for built for zero, one of the things we look at is we need to identify who's actively homeless, and then we can start looking at inflow and outflow. So that's sort of what this graphic is representing. We do get into a lot of the dashboard definitions down here. What does it mean to be head of household? What does it mean to be active? What does inflow and outflow mean? What are the specific definitions within that? We also included a section on the monthly by name list inclusion criteria to explain how one gets included into the by name list and what all that means for inflow and outflow. So there's a bit of a synopsis down here that you can read and get a little bit of a sense of who's being included. Then we'll get into the active overview. So the active overview, hold on. There we go. The active overview, it's pretty much a 30,000 foot view of all of the active populations in our system. So you can see them side by side. If you hover over any point, you'll see the date, and you'll also see the number of households for that date. And you can do that with any of these populations. So this is all clients, singles, families, and then we get into different populations: BIPOC, white, chronic, unsheltered, elderly, veterans, and youth. For the flow details, this is where a lot of the details come in for this dashboard. For here at the top is all actively homeless. So what this is showing right now is all heads of household. But if you hover over that, you'll be able to see the complete number, the total number of clients that's included in that count for any of these states. As we move down the total inflow, total outflow graph, you'll see that any of the areas that are blue, that is when our outflow outpaced our inflow. And any place where it's more of a yellow, orangish, sorry, I'm colorblind, so if that's not the right color, I do apologize, but I believe it is orange. That is when the inflow is outpacing our outflow. So it's just kind of a visual. And again, if you hover over, you'll get the numbers for that month of both the inflow and the outflow. Same thing for inflow detail. You can hover over and get the actively homeless number plus the inflow and outflow breakdown. Same thing with outflow. One of the things that a few things I would like to point out about the detailed dashboard is that it can be filtered in a number of different ways. You click on the little gear, you can filter it by population. So say if we want to look at unsheltered only, you can do that. You can also add, you can either look at it as a graph or a table or both. So it'll pop up information as a graph and a table. You can look at different date ranges. So if you want to look at only 2021, you're able to do that as well. Another thing that you can do, if you're wanting to look at definitions and not wanting to flip back and forth between the information page to find it, you can hover over it and a definition will also appear. So you don't have to keep flipping back and forth. I think that's a nice feature. All right. And then, yes. And then the reliability for Built for Zero. The threshold is anything that's below 15% or below is considered excellent from Community Solutions. Right now, the reliability threshold is well below that. There are small changes and differences, and that pretty much has to do with clients changing a response value or not providing a date of birth, maybe changing populations in the middle of the month. So maybe they were not part of chronic population and then they were, or vice versa. That would be accounting for some of these smaller changes. So I know I just threw a lot of information at everybody. So if there are any questions or if I want to toss it back to TJ for general discussion. Thanks for letting me present.
Yeah, thank you, Stephanie. And I will just say, you know, Madam Chair and members of the board, like this is years and years in the making. This type of data is not widely accessible in other communities across the country even. And so this level of viewpoint into our system is truly a really incredible thing. And so from our standpoint, we do want to give a shout out to Solari as well, kind of echoing Jen Dangermon's words. This is an incredible amount of work, and we hope that this can be supportive as the board seeks to continue its strategic plan in working for homelessness and having it be informed by data like this.
Thank you so much, Stephanie and TJ and Solari. I hope you guys are out there today. I thought this was just incredible when I viewed it for the first time. And maybe some folks have some questions about that piece, TJ, where, as you all can see, there's so many data points and you have to really know what they mean and know how to frame them in order to use them correctly. And that's why we've been talking about having a quarterly public articulation of this information in some kind of dashboard that would always be available, so that someone isn't pulling it up on, one day versus another day, having public numbers go out and then, 2 days later it's changed, because this data is real time. So you don't want the public being confused about why one day we said it was this, but the next day we're saying it's this, or confusing definitions. So the idea was to have a quarterly publication of some kind that would give a pinpoint of the data. Can you speak to that a little bit more, TJ? Are we voting on that today?
Yes, and so the actions really recommended are, if you agree with the recommendations from the data subcommittee and committee of using this naturally as a more expansive descriptor of what is going on in the homeless sphere. And then also the second item for action is, if you want this based on the recommendations of the committee and data subcommittee, it is to not open this visibility completely public, but to have this just visible to all COC related efforts and committees. And then again, MAG would work with the data subcommittee and HMIS to produce a visualization quarterly of interpreting this data. And so, for example, what that interpretation would look like is, as you can look at these numbers, our numbers starting in May 2020 substantially increased. It's almost double, right? So it's 2,859, and now it's up to 5,038 households. And so rather than leaving that open to, well, it just was bad, the idea would be that MAG would work with the data subcommittee and the HMIS team to say why, or at least to the best of our knowledge, why were those increases happening? Why was it so low in May of 2020? Why is it higher now? So that rather than just looking at the data and trying to come to those conclusions yourself, or trying to figure that out on your own, from a systems perspective, that can be provided to the public, community members, and obviously this board, its committees, and everybody else. It would hope to frame this data to be useful and not just a lot of numbers on a screen.
Perfect. So there are two actions that we're going to be considering today. One is going to be to use this system flow information as the way that we describe homelessness in our community, rather than the pit moving forward. And the other is going to be to not have this publicly available at all times, but to put out those regularly scheduled looks at the data. So do any members of the board have questions, comments before we move to those types of actions? Bruce, please.
This is great data. It's really exciting, and this really looks so friendly and accessible. Great, but one of the problems with data is that you can still have erroneous conclusions. So can staff or the committee, whoever, turn this into kind of talking points or takeaways, or, so if we're going to start using 5038, that's a major bullet, start using that. And how many are the unsheltered? What's the unsheltered? And without, you talked about taking some time, TJ, with the why, because those are harder questions to answer. But like, if we could focus more on the what. So what do we now know that we didn't know, or what is the new truth that we're all working with? And I started wanting, it's just as a screen view, I started wanting to play with what does the cumulative numbers look like? And maybe these are all cumulative numbers, but what does it mean at a certain date in time? From this date to this date, it means this. And that's just facts. So it would be helpful to have that done kind of quickly, I think.
If I may, yeah, Madam Chair Bruce and members of the committee or of the board, the idea would be that quarterly synopsis would answer the what questions as well. So as to say, here's where we're at. And so all of this is up for discussion, and you can change those recommendations as well, right? So if you're wanting something specific included, or the cadence of that inclusion, of, hey, we want this update monthly because this comes out monthly. I will say, we want to be mindful of capacities of the HMIS team and the data subcommittee and MAG, but we want to make this useful, right? And we want this data to have talking points, to be simple, so that you all can not only see the data, but you can then have a clear understanding of where we are at. And that can happen more frequently than once a year, like we were doing with the PIT.
Thank you. Great.
Other questions, comments? I'm just scanning all the people who are on the call. I'm not seeing any hands up.
Oh, Ryan, this is Joan.
Great.
Just a comment mostly. I love the idea of this quarterly synopsis and then analysis of the data. I know there's a lot of conversations in the community around messaging. So I'm hopeful that MAG, if MAG staff are going to be a part of that, messaging, that it's all working in concert.
Thank you, Joan. Bruce, is that a hand up again? That's your old hand up? Okay. It might be, you know what? It looks like my cursor just turned into a cute little hand. So I was cursored over your face. Sorry about that. All right. Anyone else?
Madam Chair, it's Eric Cole. I'm just letting you know I've
hey,
joined
Eric.
the meeting. Hey, how are you?
Welcome. Glad to have you on board today.
Thank you.
Chris, please.
Yeah, just to clarify, so I know action one is to consistently use this as described quarterly. I'm not sure what that would look like, because I know data often will generate lots of questions. So I understand kind of knowing in advance what that's going to be and how we're going to send the messaging and or bullet points. But it's also reads that it's going to go hand in hand with the PIT, not to replace it. Just from the standpoint of nobody likes it, but it's been there for years and years and years from a trending scenario versus now you're going to more real-time quarterly kind of glimpse at it, which I think is helpful. We know that once the count's counted, it's obsolete. We work on day to day. Here we try and focus on what's our number, a budgetary number we interact with over a course of a year. That's how we have to match up with our dollars. So we might as well be talking about how many total are we dealing with over the course of the year. I know a lot of people are going to love the opportunity to see data. I've already had inquiries as to what could be shared, how much could be shared, how much drill down would you have? You showed some here. I know you don't want to make this dashboard available. That makes sense because it's just going to generate lots of questions. However, what you do share with them, they're going to want perhaps to know even their little slice of it. If you could drill down by city. The biggest thing I've always had from a city is being able to see the city numbers and the city borders. And a lot of times the data is not at a city level. It could be any other zip code or any other thing that doesn't really fit necessarily a city need. And that's where many of our constituents are going to be wanting to see it.
Go ahead.
Yeah, I can respond. Madam Chair, Chris and members of the board. So a couple of points that you mentioned there. You're exactly right. This is not intended to replace the PIT. We know that many of you use the PIT in, things like contracting and in language that is a little bit harder to change. We understand that. We're not going to purely replace it. The idea would be that this could be a more consistent review over the year outside of that time in January through April, where we can really describe what else is going on. And the other value that this provides that the PIT doesn't is with the inflow and outflow, which I think we really want to use that for us to better understand what's going on in homelessness, right? A point in time cannot accurately describe what's going on because there are people coming in, right? If there's 5,000 people today and we house 5,000 people, we didn't end homelessness, right? There's going to be an inflow of people coming into the homelessness sector. So I think we need to, it's almost reframing how we even view the problem of, for us to impact homelessness, how can we address our inflow? How can we reduce our active? And how can we increase those going out of the system into positive places? And I think so that is just to supplement what the PIT provides and not replacing it. Secondly, I don't know, Stephanie, if you want to chime in, but this at this current moment does not provide city level data or municipal level data. And there are some concerns around doing that with the level of data that we have in showing the inflow and the outflow associated with it. But Stephanie, could you provide any other details on that?
Yeah, right now, I do not believe that the dashboard has the capability of doing that. That would be a bigger conversation and lift, like TJ indicated. So yeah, I would need to defer to my leadership on that. But yes, right now it does not have that capability. It is just a system-wide overview.
So, and then the last thing that I would say, Chris, is I think we would, if the board approves these measures, that second item would be, we would really want to solicit your feedback on what that would look like. Are there questions that come out monthly and then the synopsis seeks to answer those questions, things like that, right? Where it's not meant to be done in a vacuum and then produced. It's meant to be informed by the people who want answers. And so we can hopefully get some time for Q&A and figuring out the level of detail that would be provided in that synopsis as well.
Thanks, TJ and Stephanie. To that point, this might just provide a little bit of anecdotal perspective. I was able to use this data for the first time last week in a presentation to the Chandler City Council. And the way that I utilized it was from a slide that MAG had previously published utilizing this data. And it was a simple 3 columns, and it had May, numbers in May, and then it had a data change column, a delta column, which is based on the inflow and outflow. What do we anticipate over the next 12 months? And then a May 2022 column. And it gave me the opportunity to, one, describe sort of the differences between what they're used to seeing from a PIT, point in time in 1 year perspective, and this new kind of data, and also gave me an opportunity to sort of plant some seeds around the concepts of inflow and outflow, right? That, homelessness is not a static issue, and you really have to consider, we build and build, but you also have, and they wonder why perhaps we're not making a dent in the issue, but you have to consider the inflow and the outflow. So when we do implement interventions, the outflow is impacted but when we still have things that are adding to the system, when the spigot's still turned on, people are still coming. So it gave me an opportunity to start that conversation and then just use 3 points of data from all of this data to show a trend. Here's where we were, here's the amount of change we can expect based on inflow and outflow, and here's where we'll be in a year if we just keep doing what we're doing right now. So those were just 3 pieces of data from a couple different subpopulations. I think it was very simple. It was singles, families, sheltered, unsheltered. And of course, you could do so much more with this data, but you can also just pull little points based on what you're trying to show from this data, but it's real time and it's informed. It's not just a photo, but it's it's a description of a system. So I don't know if that lends any clarity to everybody, but I felt it was helpful and it was well received. And I think a little bit shocking to see those numbers. The other thing I wanted to speak to was, I can't remember where I saw it, but I know that MAG had offered, I think as part of our action planning, working on the implementation of the action plan around the categories and strategies that we've already approved. MAC had offered to start working with separate municipalities on collecting local data. So I don't know if there's someone on staff that can speak to what that might look like for any municipality that's interested in going down that road.
Madam Chair and members of the board, a couple of things, and I think this does kind of tie into one of Amy Schwabenlender's questions too. So I'll seek to answer that and answer your question as well. So Amy Schwabenlender's question was, does the systems flow dashboard connect to the support of the regional plan? The answer is yes. So as a part of the projections we provided to this board last month, it included data that Ryan just referenced of what is the active and what is the projections going forward. All of that data was based on data from the system flow. And so it is very heavily informed by both, or the systems flow is informing the regional plans so that we are rooted in that data. And then to answer your question about specific municipalities, there are a couple of options there. And then Stephanie, if you want to stop sharing your screen, I think we're good on the, thank you. And then we have been working with any municipality who's interested on supporting develop what we're calling just like local profiles. And much of that is inclusive of just like data from the census tracts, eviction data, rental data, point in time data. And then we have worked with the HMIS team and multiple times, and I think Stephanie can speak to some of that too, of actually providing data based on zip code of last permanent address and providing that to local municipalities upon request. So all of that I think can be available upon request and discussion with whoever is interested.
Yes, that is true. Yes, we can provide that data.
That's perfect. And who should folks contact? You, TJ, or Stephanie?
Yeah, for the local profiles, you can start with me, and then I can make the connections from there for sure with our HMIS team.
Okay, thank you, TJ. Bruce?
So I was going to ask about the where people came from question and whether we're as far as we can get. And I know their questions are, none are perfect in terms of asking the question, and the data has some challenges, but do we know as a system for a year what % of people came from other states or other counties in Maricopa other than Maricopa? Do we know that now, or do we have at least the best number possible now on those two?
Bruce and the board, I think I'll defer the part of this to Stephanie so she can clarify. We do have the same data points and a couple of different ones that can, so initially we have, your zip code of last permanent address, which as you alluded to, has some question marks around quality. It is something, it is not perfect. We also have a couple of other things like that are related to people's assessments related to the city where they stayed last night and things like that. So we can produce that information on whoever has filled that information out. But we do, as you mentioned, take it still with a grain of salt. It can be useful, but we still get a lot of people saying that the zip code of their last permanent address is the downtown campus with no residential areas, right? And so there is some data quality there that can be managed, but I don't think we throw the baby out with the bathwater, so to speak. I think there is something that we can glean from that, but we do have to take it with a grain of salt in that we know there's data quality issues with some of that information. Stephanie, did you have anything else you wanted to add around location of clients who are experiencing homelessness?
No, that pretty much summarizes it. Yeah, there are those data quality issues with using last zip code or with using, city of assessment. But as TJ said, I think it could be valuable as long as we keep that in mind, that the reliability on that data could be a little bit lower than we would like, but I think it could still be useful as snapshots.
Okay, thank you very much. Are there any other questions or comments from the board? I don't see any. Staff, do you see hands I might be missing?
No.
Okay, great. Then I'm going to go ahead and ask if I can get a motion for the following steps. So the first would be to consistently use the system flow information, excuse me, to describe homelessness in the community. The PIT will still be used, but the system flow will provide a more robust description of the ongoing status of homelessness. And the second will be that the dashboard would not be publicly visible, but accessible to all COC-related committees, subcommittees, and work groups. MAG would work in collaboration with the data subcommittee and the HMIS team to produce a quarterly synopsis and analysis of the data. This quarterly report would be publicly distributed. Can I get a motion on that? Do we have more questions?
Madam Chair, I have questions around the second point, which we really didn't discuss that much.
Okay.
My
I
position-
think just, Bruce, let me just, for the sake of following Robert's rules, can we get a motion and a second, and then we'll have discussion and then we can amend? Or do we need to do that, staff, since we don't have a first yet?
Madam Chair, it's Amy. You are not required to have a motion and second prior to moving to discussion. You can still take discussion at this time.
Perfect. Okay, Bruce, thank you.
I was going to maybe suggest splitting it into two motions, but if we can discuss them now. And
Okay.
I don't want to get into the legalities of public records and whether it really is public information. I just think it's everything we've done has been transparent, and I've got no issues with anything we've ever done. The phraseology of the second one, I think, is important. I mean, I think what we're saying is that we have to, as professionals, have the ability to review the data to make sure it's accurate and understandable. Giving public information that could be misinterpreted is not a service. So I just think maybe we want to be or capture in this discussion, what the really intent is. It's not to make information available to the public. It's really to make sure that the data is good, that we understand it and all that before those kind of things are shared. So anyhow, I'm totally on board with the first part question, that if I'm the only one, we should proceed.
I think those are really good points. I would be for, let's take them one at a time. So let's go through the first one first, which is I'd request a motion that we would commit to consistently using the system flow information to describe homelessness in our community. The PIT count is still available and may be used, but we would use the system flow information to have a more robust description of the status of homelessness in our region. Can I get a motion around that?
So moved.
Thank you, Bruce. Can I get a second?
This is Marshall. I'll second.
Thanks, Marshall. So we have a first and a second. Is there any further discussion on this motion? Okay, seeing none, I'd ask staff to take a roll call, please.
All right, I'll begin with you, Chair Ryan Balch. How do you vote?
Yay.
Thank you. Eric Cole, how do you vote?
I'd like to abstain, please.
Thank you. Elizabeth DaCosta,
Aye.
Marshall Franklin,
Aye.
thank you. Tad Gary,
Aye.
thanks, Tad. Chris Hallett,
Aye.
thanks, Chris. Bruce Liggett,
Aye.
Thanks, Bruce. Joan Service.
Aye.
Thank you, Joan. And Charles Sullivan.
Aye.
Thanks, Charles. The motion passes.
All right, thank you, everyone. Let's go back and tackle the second item. What I'm hearing and would ask for a motion towards is that, I'm sorry, Tad, are you raising your hand or no? No, okay. Is that we utilize the new data that is available in a responsible way, gathering information from it for planning and policy purposes, and that in an effort to be transparent with the public, we publish quarterly a dashboard that explains the data that is available. You can change it. That's sort of what I'm thinking.
Madam Chair
Yes, ma'am.
and members of the board, I agree. I think I agree with the way that you heard it. Previously, I'd written down staff will provide quarterly updates to ensure appropriate messaging and robust analysis are available to members of the public. In addition, continuum of care members will have full access to the data. Bruce, does that address your concerns? Okay.
It does. And I think capturing any conversation we had that talks about our commitment to transparency.
Oh, absolutely.
Yes.
Yes.
But yeah, working drafts, we have to have draft material we can work with and continue to analyze before we release it. So we just want to make sure it's solid and digestible before it's out there. That's all.
Absolutely. Thank you, Bruce.
Does someone want to make a motion in that direction?
Well, I would move the summary that Amy just explained.
Thank you, Bruce. Can I get a second?
This is Liz. I second.
Thank you, Liz. All right, we have a first and a second. Is there any discussion? All right, hearing none. Staff, can you please take a roll call?
Chair Ryan Balch,
Yay.
Eric Cole,
Sorry, abstain.
okay, thank you. Elizabeth Acosta,
Aye.
thank you. Marshall,
Aye.
Tad Gary,
Okay.
Chris Hallett,
Aye.
Bruce Liggett,
Aye.
Joan Service,
Aye.
and Charles Sullivan.
Aye.
The motion passes.
Wonderful. Thank you, everyone. It's really exciting. And thank you to everyone past and present. I know many long hours and lots of thought have gone into getting us to this point, with many people who have come and go and changed positions and all that, but we're thankful to all of you. So let's see, moving on to our next item. TJ Reed, Regional Homelessness Project Manager at MAG, will provide an update on the regional homelessness strategies. TJ?
Madam Chair and members of the board, we have added this item just as a consistent every single time the board meets. We wanted to provide an update on this for full transparency on what is going on in our regional efforts and our regional coordination teams. So since our last time that we discussed, we shared a lot of information about the regional strategies and then some of the cost data that was provided. And that was provided to the board in presentation form, but also in an Excel document with lots of details that I'm sure were fun to sift through. So what we wanted to share is between the last meeting and this meeting, the groups have really focused on shifting from a big picture to actionable steps. We're getting really close to a prioritized list for draft with our regional coordination team, which is made up of our local and tribal governments. And during the September time period, it is requested that we would love the Continuum of Care Board to be a part of that process and to really solicit feedback and expertise from the homeless leaders in our community. And so a big part of this update is simply just stating where we're at. And then the second part is up for discussion of if the board is interested in identifying volunteers, not only from the board, but in addition, the committee to review the prioritized action steps and provide feedback and expertise into that process so that we know that this group of experts has informed the process as best they can. We know that this group has been a part of this process for a long time now, and we're now getting down to the tangible action steps, which I think is where many of us are really interested in getting involved. So I'd love to hear just perspectives and discussion on that. The other thing that I wanted to share is really to just provide some space and time to go through some of the questions that Amy Schwabenländer brought up related to the regional plan. And I'm going to pitch many of these to Amy St. Peter. So the questions, and maybe we can just go through them one by one. But the first question is this an update on behalf of the regional collaborative or just MAG is the first question. Amy? Yeah.
Madam Chair, members of the board, thank you, Amy, for those questions. We continue to meet very often with the members of the regional collaborative on homelessness. They continue to help inform and shape these efforts. So they are one of the partners in this work, in these regional efforts. And so when we're presenting updates on the regional action plan that's under development right now, that does include feedback that we've received from the regional collaborative. And I know you had another question about where can you go to access information on the full collaborative. We don't have necessarily a separate website or anything like that. They are continuing to be very engaged in these efforts and to provide input. And so the information that we share is representative of the collaborative as well. We do not have separate reports or separate work products that have resulted from the work of the collaborative. I understand that you had another question about regional council and what action are they taking, and then what is the board taking action on. That will mirror the very similar process to what we undertook for the action that was taken on the strategies that were adopted back in May of this year, whereas management committee took action first, and then the Continuum of Care board, and then the MAG regional council. We do see this as a regional action plan, in particular increasing the alignment between the local and tribal governments with the Maricopa Regional Continuum of Care. So as a result, all three entities will have the opportunity to take action on the action plan when it is offered for action later on this year. Are there any other questions or clarifications in regard to those questions?
Yeah, and I'll just add one thing to what Amy shared. So we don't necessarily have active updates on a website for the action plan, but we do have on MAG's website the full list of strategies and corresponding documents if people are interested in reviewing that. And that can be found on MAG's website under programs, homelessness, and then regional homeless strategies.
Absolutely. Thank you, TJ. And as materials on the action plan are developed and are ready to be shared, then those will be on the website as well. I was referring more so to, we don't have a separate space just for the collaborative because the collaborative isn't taking separate action on these efforts. So, but thank you, TJ, for pointing out where to find all of this information on the MAG website.
Awesome. And so, Madam Chair and members of the board, I think we can open this up for questions and discussion. And then we were curious in terms of hearing the board's feedback on establishing a group of volunteers that can, the thing is, right, it's a lot of information and we can do it in this board meeting, but I think sometimes there's more time that is needed to really get into the details and kind of dissect those things. And really solicit a lot of feedback out of that can be done much better in a meeting solely devoted to that process. So, I'll give it back to you, Madam Chair, but that would be the request for discussion. And if there's any questions, we're here to answer those as well.
I wanted to just start out by saying that because of our functions in our professional roles, myself, Marshall, Chris, and Bruce have been involved in the implementation team because it is being started out by tribal and local governments. So we're all very actively seeing this work come alive and all the work that's being done, and we're keeping up as a function of participating in that. But my concern, and I think Mag's concern, is that this will be coming to the board shortly, and we'd like to see board members besides ourselves. And one, we'd have to decide how that was, maybe have a work group. I think Mag was suggesting to look over this information and stay up to date, so that we're moving very quickly, as you can see by the timelines, so that when it does come to us for a recommendation to the regional council, we're ready to go. So that would be my thought, but I'd like to, I know this makes sense to me because I'm following along, but it's a lot of moving parts. So I wanted to see if any of the board members who are not actively working in this process right now have questions about the process or what's coming next or anything like that. Or are potentially just ready to go and want to volunteer to be on this work group.
Ryan, this is Todd. I definitely volunteer to be, I'll volunteer to be on the work group. So.
Great, thank you very much, Tad. That'll be a super helpful for many reasons. Okay. Anyone else? And I'm wondering, staff, does this need to be a separate work group, or might we consider adding interested members into the implementation team, or do we want to keep that separate for now? What are your thoughts on that?
Madam Chair, members of the board, we want to make sure that we really hear the voice of the Continuum of Care board. And so I do think it'd be great to have a separate meeting so we can ensure that any of your concerns, your ideas, your suggestions are just really fully addressed. And so our recommendation pending your feedback is to make sure that we provide that space for your voice very directly, and that be a separate a separate meeting. Thank you.
Okay,
and I do see
thanks.
that Eric Cole is also interested in volunteering. Eric, thank you very much for that. Be happy to have you on board.
Thank you, Eric. Anybody else interested in participating on that work group? All right, well, if you consider it at a later time, please let MAG staff know, and I will assume from their MAG staff, you will set something up. Get in touch with us and let us know. All right, thank you very much. So we are going to move on to the next agenda item. Jamie Taylor from the Shared Housing Institute and Daniel Davis from Home Eq will provide an update on the Shared Housing Institute. Jamie and Daniel.
Good afternoon, everybody. And this is good evening for Jamie over on the East Coast. We just want to give a quick update as to shared housing, where we're at in our process, and then also give a quick overview for anybody who hasn't been on a committee meeting or hasn't been to some of the presentations about this. So Jamie's going to give a quick overview as to what we're looking to build, and then I'm going to go over where we're at currently. Jamie's going to present her screen, and I know her presentation is a little modified from the one that you'll find on the MAG's website on the materials for this meeting. And Jamie, you're on mute, by the way.
Thanks. So I've been listening to all your presentations, and it's very exciting to see you have dashboards to make data visible. And someday the shared housing data element can also be made visible, hopefully, so you can track where you are. We, the Shared Housing Institute, kicked off a national learning collaborative that you've been hearing about. So it's really for intrepid innovation leaders who chose to come in from 4 different geographies, and Maricopa County is one of them. And we spent 12 weeks, and I think you've been hearing all along the way some of the work and some of the focus. So we're just going to do a very quick overview of what we've been doing with shared housing. We all know why. We all know Phoenix and across the country are seeing 20% increase in housing costs. You saw actually the trend. It was a 2021 trend where your inflow was far outpacing your outflow, and that will continue. So shared housing is something that's been a part of our housing norm, as we all know, ourselves having lived in shared housing. And the idea of Maricopa County coming in was a commitment to figure out how to bring this culture into your own service system. We know that across the country, it's been adapted and adopted by organizations. To take it on system-wide has really been phenomenal to watch. And Maricopa County is one of the leaders, again, in the country who chose to do this. So it's really unprecedented, but it's also the only way we're going to bring to scale expanded options that are not out there now. And so shared housing, we're looking at it real quickly as permanent housing. It could be done in many different forms, but we're promoting permanent housing option, shared housing. It's also what HUD requires, that each tenant will hold their own lease. They have a choice to stay or leave, as anyone does with a tenant lease. And it's really about 2 or more unrelated people, each having their own room, and they're sharing common living spaces. So we've seen the Shared Housing Institute exist because we've seen this working in very large organizations across the country. We've tracked their data. These are very, very mature Housing First programs. You can see that some are PSH, some are rapid rehousing. There's another one that Maricopa County and Daniel's actually partnering with around landlord engagement, and out of Oakland, Bay Area Community Services, and they actually housed over 2,000 people in shared housing using rapid rehousing since 2017. And what we wanted to do and what we did in the Learning Collaborative is bring together the collective practices of what's working effectively across these organizations. So that Maricopa County and San Diego, Philadelphia, San Bernardino County, the 4 geographies in the Learning Collaborative could pick up those and make them their own, bring into your own system what you want, what fits, but really understanding that in order for your shared housing to be effective, you want to address each of these different components. And so there are different ways of doing it, but essentially you want to be looking at effective shared housing client messaging. So you really want that culture of everyone in the system understanding how shared housing can work, making it a conversation, not a must-have or not something people have to decide in any 1 minute. And really using the tools, and we're going to see a little bit of the tools that Maricopa County is going to adapt and have your own toolkit based on what came out of the Learning Collaborative to move people through once they're accepting into shared housing. What does your own local housemate match process look like? What does your housing stabilization look like? How are you monitoring shared housing? And what does your landlord engagement look like? So in shared housing, we've learned, these came out in the, over and over again, these came out actually in the Learning Collaborative, and people are able to move out of homelessness sooner, as we know, as it makes sense. You have more options. So right now in Phoenix, I was looking at a website today, and your average 3-bedroom is $2,095. And so when you think about, and that's a 3-bedroom, not 2-bedroom, 2-bedroom average rent was $1,500, 3-bedroom, $2,095. So you think about 3 people in shared housing able to actually afford an apartment with hopefully in a better neighborhood than they would if they even could find a single unit somewhere. And they're paying less than $700 each. And what shared housing does is bring those housing options more visible into the system so people can have choice. and also can begin to create a kind of community that we all need, especially in COVID. We've learned how important our own households are. We've also seen in effective shared housing programs over and over and over again that one, affordability is number one, helping people afford housing is the number one reason for shared housing. And two, right alongside it is actually decreased isolation, increasing that support network that helps us all sustain ourselves. So during the time together, Maricopa County picked up a lot of information from national leaders, a lot of tools. One of the things and I've learned, I've been doing this now straight on for 3 years, only shared housing, bringing and understanding practices. I'm an academic, not a practitioner. And our team now is bringing them across the country. But really this sense that shared housing needs to be a conversation and it's over time, and we really want to support natural existing relationships. Just this type of thinking about the clients that we serve, very often we think maybe the networks that they have are not healthy ones, maybe that they can't make the best choices and we want to protect them. But we've learned from the effective shared housing programs that really supporting the natural supports and ensuring that that kind of relationship development happens, and using the tools that are in the toolkit to bring that out for your staff across the system to understand is really where Maricopa County is headed now. One of the best tools we have is this Housemate agreement tool, and you can tell it just makes sense to make visible all of these issues that are common with anyone living together and really get them upfront signed during the lease up time point. And really it's a contract between housemates, right? It's not driven by professional case management, it's supported, but it's really the client choice on understanding deal breakers and making visible what they want as a conflict resolution baseline. But these tools, of which we have a whole 25-page toolkit now that's in the hands of your leadership to adapt, is really going to bring out ways to support your system to bring this up to scale so that you internally can bring it out in the way that you want your housemate pairing process to happen. These conversation cards, how you're going to incorporate those into your system so people can talk about deal breakers. When do they sign the housemate agreement? And again, starting with client messaging, all along the way, supporting client choice, supporting the ability to actually have agency and where you're moving forward. And Maricopa County has really picked up the leadership side of this to frame it out as a whole process. So it's really the whole arc of what do staff need in order to support that choice. We've learned, and I learned myself, motivational interviewing, number one skill set to be standardized across the system, that everybody who's touching clients need to have motivational interviewing. And that's a foundation stone for any kind of interaction that's going to be effective for supporting client choice. All the effective shared housing programs are based on this client choice effectiveness. So Maricopa County is committed to doing a kind of centralized training framework that Daniel can talk about, based on seeing what needs to standardize. The state of Connecticut did the same thing out of the training. They saw they didn't have the standardized kind of training across the board that's required for effective shared housing. So they've actually standardized their motivational interviewing, their harm reduction, their trauma-informed care. And also our professional case management stops and community supports and connecting clients with community supports really has to be start focused on early on in the process, especially in shared housing. It's an opportunity or lens to bring these tools in. This is another example of a tool that that staff can use with clients to support this perspective of themselves moving forward in their own path of wellness, and really giving them, again, an effective toolkit that can help throughout the entire process, support agency, support the ability to develop relationships, have relationship tools inside the system that support that in shared housing. Also support conflict resolution. We have a lot of conflict resolution skills in the toolkits also. And once people are leaving professional case management, also to be able to have the support in the community. So it's really been amazing to see the depth actually of your leadership, what they're taking on. you already have a preeminent landlord engagement entity. They're bringing shared housing across the board for all of their housing location trainings that Dana could talk about. And that'll become a national model, but you are actually in the trend right now to be one of the first systems to actually do shared housing system wide. But fundamentally, how you're doing that is building up your foundations across your system to then bring in the shared housing tools that you've got out of the Learning Collaborative.
I think Jamie did a great job of summarizing the past couple months for us. For those of you who don't know, Bruce and Rachel and Scott have generously funded this effort and have participated a lot in leading this whole initiative. And I'm not used to being the slowest moving person in the room, but it's mainly been held up due to me. So we've got a bunch of doers on the team, and Liz, who's also on the board here, is a part of that as well, along with Laura Scott, Nikki, and Cricket Weatherington, and Richard Cruz from the campus. 1 second, please. I have that post illness voice, so I'm going to try and keep it short today. A quick update as to where we are. We've gathered all the relative CFRs from HUD, and fortunately, one of the big HUD TA trainers for shared housing just finished her presentation to you all. So we're leaning on Jamie pretty heavily there. She has all the expertise as to what can and can't be used towards shared housing. So we're going to consolidate that into one framework for providers to feel sure that this is a really good option that fits within their funding. And then we'll research any local pass-through dollar limitations that have been maybe incidentally put on. We're hosting a team of providers that are they're starting to reconvene after the 12-week cohort. They're going to be going over the training material we received and also contextualizing that to our county and our community. They'll also be finalizing some of these tools like a housemate pairing process. How do you get, you develop some interest in somebody, and how do we find out that they're going to be successful together? At least, give them the best shot towards that. Also, they're working on a roommate agreement. So this is something that's informally made between the two roommates or three roommates or however many there are. And then also bifurcated leases so that landlords understand and the supporting educational material for landlords to know what shared housing looks like, what happens if one person wants to move out, what happens with the damage and claim and vacancy loss. There's actually a lot of benefits to landlords for this, and you'll hear more about that coming soon. But the main thing is that it really recenters client choice in a lot of our conversations. So shared housing gives clients the ability to live with their support system. We're always talking about this when somebody gets housed, when they get employment, when they get connected to their health provider and all these various support groups. Having some sort of non-professional support group is really important for everybody's success, right? Even outside of this homeless system. So trying to recenter that conversation in a lot of our trainings as well. Ty Rosensteel from Solari is going to be discussing the UDI and data tracking in the data subcommittee group in September. I won't get into that much other than to tease that there is a question already going on in HMIS, and we're gathering feedback as to what interest clients have right now. So I don't want to steal his thunder. I'll let him take that. Also, we'll be meeting with iHelp and Ascend to go over to make sure we're not duplicating any efforts, because a lot of you have heard they won that shared housing award from the Arizona Community Foundation a few months ago. And then one thing I want to highlight is, and this is why especially Rachel Milne has been such a big proponent of this, is that this is going to be a permanent tool for our community across municipalities, across unit size, across all subpopulations, and across all interventions. So whenever a client is going to self-resolve out of emergency shelter or any of the housing interventions, this is a great opportunity for them to live with their family. Or, we've been talking a lot about equity, EDI, equity, diversity, and inclusion. And this really frees up multi-generational households, which is something that the homeless system isn't really set up to support just in general. So really excited to offer this, and maybe, this is not the silver bullet to homelessness, obviously, but it does bring in a lot larger units into affordability for our clients. This is something also, by the way, that clients are doing right now. We're hearing this. We're anecdotally hearing this, that's happening, and it happens outside the homeless system, obviously, but then also just providing that kind of formal framework for everybody to participate in. So, and landlords have been asking this, especially landlords who want to participate in any of the voucher programs. We get this at Home Inc. a lot now, actually. People with 4-bed, 2 baths, they want to split it up, and we just haven't really drawn out what exactly that looks like. So yeah, and actually I've heard from clients something that Jamie pointed out earlier, splitting the multiple bedroom homes up for clients. Their access to living areas also increases. So usually, an efficient unit or a studio apartment usually has a pretty small kitchenette compared to the appliances and the dens and the living rooms and all these different, in the backyard and a lot of these different aspects of renting a house instead. So we'll have more to share with you forthcoming, especially as we finalize some of this content and have something to prepare. But the main goals are going to be to keep the COC apprised of what we're doing, finalize that training and start to roll it out with the providers. And then the landlord liaison program that Home Inc. is going to be rolling out here in a few months will take care of all the landlord engagement. So thank you very much for your time. And I'll open it to questions or feedback.
All right. Thank you so much, Daniel and Jamie. That was amazing. Shared housing has personally been a pipe dream of mine for as long as I can remember. But those of you who got together and made it a real thing, thank you so much. It's not a not complicated intervention, but I just think it's going to be so worthwhile. So thank you so much. Are there comments or questions from the board? Bruce.
I thought that was great, Jamie and Daniel, and thank you. And all the credit in terms of what Maricopa's role has been here goes to Rachel Milne, because she's really just made it happen. And frankly, early on, I wasn't paying enough attention. And so she's been able to tell me the benefits to our community. And almost every example that Jamie provided was smaller than Maricopa County, LA County, obviously bigger. And I just thought, like, well, somebody could say, hey, I got a deal for you. You could make like 200 beds, 200 more beds. You want to do this? I thought, absolutely. So this is going to have a real impact, and the other benefits that Daniel mentioned are great. So I'm excited.
Can someone speak to the rollout time in our community?
Yes, I can. We don't have a set date. We were hoping that it'd be in January, but we have quite a bit of content to finalize. We were trying to do all of it at the same time. We're trying to do it through the cohort and build the materials and finalize where these trainings will live permanently in our community. Who's going to own coordinating the events and training the trainers and all that. So we feel like we bit off more than we could chew. So we decided to wait till we were done with the cohort to start building out some of these pieces. So we don't have a hard date, unfortunately, but the first step would be rolling it out with the providers, and then also setting up with funders and the COC, just an appraisal, I think. So.
Thank you. And just to follow up to that, will Ascend's program roll into yours, or is it going to be separate, or are we not sure yet?
That is the conversation Rachel and I are having tomorrow afternoon.
Okay, wonderful.
With Ascend. So.
And also, can I just add that, the NOFO's out now, and there's a lot of money in there for rapid housing. And you could use some of that money to pay for a shared housing coordinator. It's one of the things we're supporting all systems we're thinking about. And actively right now, you could be putting it into a rapid housing project to pay for that shared housing coordinator. We are seeing that in Connecticut right now, the first state to do that. They hired 7 shared housing coordinators. I would say one has like a system leader capacity, and he's actually ensuring the rest of them are staying in that same leadership role. But without him, all of the investment of a past year, trainings, money, incredible leadership buy-in at all levels in state departments, it would all fall apart if you didn't have that focused staff position. So just to think about it now for this NOFA.
So your suggestion is that providers that are either renewing for or newly applying for rapid rehousing and are willing to do a shared housing model could consider adding in a shared housing person, or are you saying this would be a separate project to have a shared housing coordinator that would fall under rapid rehousing?
For rapid housing, what I would do is figure out who's the largest rapid housing provider that just went through the, I don't know who the cohorts in the cohorts that we just did. I don't know who was a rapid housing provider for Maricopa County, but I would want to get someone who believes in shared housing, let them hire in the rapid housing coordinator that supports the system approach, not just their organization, the system approach. So you want a higher level person, a little more experience, but that's what I would do, because the county or the city or the COC can't spend the money, but that rapid housing program, their success and their ability to come to scale will be totally connected to the system's ability to put all this other stuff together. So that's my own personal suggestion on how to do that.
Okay, appreciate
There's
that.
also CDBG monies out there too. Other sites have used CDBG money. That's straight up. That is money you can use directly for through, again, an organization will have to pay for that. But you can also use CDBG money for a shared housing coordinator position.
Okay. So you're suggesting it's a regional effort, though, sounds like.
I'm suggesting it's a system-wide effort, yes, because you're for a lot of reasons, but mostly your housing market costs are so great. You want to expand as quick as you can, as many options as you can for those multi-bedroom units and homes. And you can't do that. You have the national preeminent landlord engagement entity. By December, they're going to have so many shared housing options up on pad mission because they'll know how to do it, and that'll be up there. But your service system has to also be paired with capacity to pull them down and to match people and support them effectively. So I think it does need to be system-wide because of who you are, who Maricopa County is, housing cost-wise.
Okay. Did you go over in the presentation, and maybe I just missed it, who was in our cohort and who might be prepared to do this?
Daniel?
I apologize. Can you repeat the question?
Did we review who went through the cohort and might be prepared to implement in our region?
Yep. So the leadership group that attended is Rachel Milne, myself, Liz DaCosta, Richard Cruz, Cricket Weatherington, and Laura Scott Nicky. The task group we had had a lot of other providers, and I can't seem to pull it up right now. But it was Mila Valle at UMOM, Wendy at Justice Center.
Okay. So we have a number of families a number of providers that might be ready and willing to implement. Sounds like Save the Family, UMOM.
I can't speak for any of the providers, but I do know that Rachel and ASU have been talking about maybe turning it into like an internship or like a part-time person to at least help coordinate it. But then, like Jamie's alluding to, hopefully building that up a little bit more to somebody who can really own the whole effort. So the first year, it would definitely look like the leadership group is going to continue keeping our pulse on it and pushing it forward.
Totally. But can I say that we found this in San Francisco. Also, I'm supporting BACS in their training for San Francisco. They weren't in the cohort, San Bernardino County. And I think Maricopa County, similar, the rapid rehousing for adults was very minimal. And that's your greatest need. And so you actually could, again, with this new NOFO, you could get a new rapid housing provider or an existing one to expand to adults and let that entity, they have to be a really smart organizational leader, to hire in a smart shared housing coordinator to work at that kind of level. But that's what I would also think about, is getting some new rapid housing providers for adults funded under this NOFO and incorporate a shared housing coordinator position. they don't call it that in their application because it's for their agency, but that position should really be a broader position, I think. But if you have some exciting providers to think about to tap into for your adult rapid rehousing, that would be phenomenal.
Okay, that gives us a lot to think about in a very timely fashion, given that the NOVO is approaching and we're going to be talking about priorities very soon. I know that discussion is happening at the committee this week or next, if I'm correct. Any other comments, questions from the board? Well, this is super exciting stuff. I can't wait to see this come to fruition in our community. And, you know, we are one of those communities that we have very little access to affordable housing at this point, or any housing at this point. So the thought of being able to, you know, make 1 out of, or 2 out of 1 is very exciting. So thank you very much, Daniel and Jamie, for providing that. I hope we can count on you in the future to help guide us through the actual implementation.
You got it.
All right, thank you very much. Okay, I'm going to move on to the next agenda item. An update will be provided on legislative issues of interest, and the Maricopa Regional Continuum of Care Subcommittee chairs and members will provide an update on recent activity. So we'll start with COC board member Joan Service, who is the executive director at the Arizona Housing Coalition. Joan, would you mind providing us a legislative update?
Hi there. Well, the good news is that we're, almost 60 plus days past the legislative session. So hopefully we're in recovery from that. That being said, we need to take a breath and figure out what our agenda is for next legislative session. Obviously the Housing Coalition will be looking at, or continuing our efforts to restore the State Housing Trust Fund, because this last, we have a bunch of influx of federal funds, but we know there's going to be a federal funding cliff. So we need that to be addressed. Additionally, this pandemic has really shown the importance and the value of coordinating and collaborating and blending and braiding all of these different funding streams. It makes me harken back to that old commission on housing and homelessness that was chaired by DES and ADOH. I do know that there's some, Director Simplot has expressed a firm desire towards connecting with his other state agency chairs, Access and DES and DBS. So there's an opportunity, whether through a legislative proposal or what have you, for that interagency collaboration. At the federal level, obviously, we're all just kind of surveying the impact, and there's a lot of focus right now on getting on supporting rental administrators who are working fast and feverishly under or to get rental aid out because of the Supreme Court ruling. Ryan, I saw you at the Housing Forum. I know that rental aid administrators. You and I talked about this a little bit. Just the sheer the shouldering of the responsibility is such a privilege and important. A very heavy burden, but an important burden. And I know you guys are all feeling that, or I know all of our local administrators are feeling that. And then finally, just at the federal level, in terms of the budget process, I think it was last week, the House approved a budget resolution, and now it's up to the Senate Committee on Banking and the House Committee on Financial Services to draft the budget package that outlines the $300+ billion in spending for housing programs. We're hearing a lot of support and discussion around strengthening the federal low-income housing tax credit program, which is something that the Housing Coalition has been, supportive of and advocating for. So we're pleased to hear that. But obviously, we're the real budget conversations and negotiations will start gearing up as they work towards a federal budget by the end of, I think it's, end of September. So happy to answer any questions.
Thank you, Joan. Questions, comments from board members? We hope you're getting a little bit of a rest, Joan, and gearing up, getting yourself ready for the new session.
Oh, no, honestly, it's you all. You guys are doing amazing work. So we're just here to support.
Thank you, Joan. Okay, seeing none, I'd like to invite Matthew Kelly, lead housing liaison with Mercy Care, to give us an update on the coordinated entry subcommittee.
Hi there, thanks for having me. I will try to run through super quick. So coordinated entry is up to a number of different things. Just as a quick update, the homeless prevention group continues to meet. That's really about integrating prevention dollars into the coordinated entry system. We have met and decided that as a first step, we're going to be really focusing on having the current prevention providers act as kind of like the access point for prevention dollars as a starting point to get the system up and moving. We have a policy document that's been put in place that we're working on a solid draft for. We're going to be integrating some racial equity language into that policy document because it currently wasn't there. And then as part of our last meeting, we also went through our assessment tool, which was an actual assessment tool that was based off of the SSVS tool with some minor changes to that. One of the major changes was really about integrating. There was 2 questions about sex offender status and criminal history. We integrated those 2 questions and a couple of other really minor changes. We're having that tool now sent over to racial equity partners for review, just to make sure before we start to implement a whole new tool in our system that we're not creating more problems for inequity within our system. So we figured we'd have them take a look at that before we move forward on implementing that and bring that over to Solari to see what we need to do to get that ready and up and running. So that's prevention. Are there any questions with regards to prevention and that before I move on? Ryan, you look like you have a question.
Nope, I'm just engaged. I think it's
Okay.
really great we're at this point.
Yeah, it's exciting that we're seemingly moving forward on things, and I like it. And I think the meetings have been really productive, so I think it's great. Also, we have been doing some work surrounding racial equity. I think I provided an update in our last meeting that we were going to be having different communities come and talk about what tool they have implemented or how they've made changes to adjust to address racial equity in their communities. We did have that meeting on the 12th of August. We had 4 different communities come and present. So we had Tucson, Pima presented, Hennepin County / state of Minnesota, Austin, Texas, and then also we had a representative from CSH who was representing Washington, D.C. We asked a series of questions about what sort of changes they've made in their system, what sort of member engagement do they have, or what feedback are they getting from members, and kind of just tried to get a sense for what each community has done. We heard a number of things from each of those communities. Really kind of a couple of the highlights are, we had one community that was basically doing no tool similar to a VI SPDAT. They were really breaking it down to like really addressing who's chronically homeless and asking a very small number of questions and really just trying to focus on where the need is based upon their length of time homeless rather than focusing on all these other chronicity issues that or other acuity issues. We had one community that was specifically asking about the racial makeup of the individual and looking at that as an effort to provide services based upon that. And then Tucson Pima, as an example, was continuing to use the VI SPDAT and then adding additional questions to the VI SPDAT to address for racial equity. So a lot of different options in the communities that are happening, but I think it kind of gave us a sense of where we want to go. One other big takeaway that came out of that meeting is we heard a lot of communities really trying to focus on what is the member choice in this and how are we asking about that and making sure that member choice in their housing intervention is actually a piece of this discussion rather than just doing a tool and saying, here's where you score. It's also now going, here's where we're at. And also, what is it that you really think you need to be successful in housing and what can you do to meet that need? So really kind of getting to that. So our next steps with racial equity are really to, I think, come back together, debrief on what we heard, and then kind of decide what our next steps are as far as how we want to move forward. I think where we'll end up going is bringing a process back to the racial equity work group within the coordinated entry subcommittee and starting to work on how we want to make sure that we're moving forward in an equitable and fair way in the community. But that's really that. So I'm super excited about that. I think there's some really great work there and excited to see progress. In addition to that, we've also added, at this point in time, we've sent out invitations to 3 new individuals to be added to the coordinated entry subcommittee. Jeff Wilgale from the VA, Mike Lafette from NAC representing youth, and then Jusani Goodman from Phoenix Rescue Mission representing Access Points. We do have a couple of other applications that are still in the review process, and we may be adding a couple more individuals to the coordinated entry subcommittee, but those are the ones that we voted and agreed upon at this point in time, and invitations have been extended to those members. So there's that. And then the last thing, the coordinated entry subcommittee, I think in the spirit of some of the dashboards that we were talking about earlier in this meeting, is really starting to look at coordinated entry data points specifically and how we can start to standardize our reporting for the coordinated entry subcommittee and start to work on that using, I think, the basis of what Solari has already put together. How can we take that and then really kind of turn the lens on coordinated entry and kind of start to evaluate the by name list in some interesting and new ways and kind of figure out what we can do to make some progress there. So we're starting to work on that as well. That was a lot.
That was a lot. That was a lot of really good stuff. Thank you so much, Matthew.
Thank you.
Really great. And congrats on making some invitations. I hope that your committee fills up real soon. Those are some great selections.
I'm very excited. Yeah.
Yeah. Any comments, questions from the board? Okay, I don't see any hands up. So we will move on to our, thank you again so much, Joan and Matthew. It's always great to hear from you. We're going to move on to request for future agenda items. Do any members of the board have an action or discussion item for a future meeting? And I'm going to add to that request, if TJ or Amy, if someone could help me decipher if any of the questions that are public asked, Jennifer or Amy, if is there anything that we still need to address at a future meeting that we would want to put on an agenda?
Madam Chair, members of the board, I was just looking at that. We do have a few items that the board could consider having as a future agenda item. One of those is the status of adding more continuum of care board members and what are the open seats. What's the status of applying for the coordinated entry equity demonstration and the timeline for the NOFO? I'm looking at the questions now. I think that is all of them.
Okay.
But if there are any other questions that we've not addressed either during this meeting or in my comments just now, we'll be sure to take that up. Thank you.
Okay. And could you tell me, Amy, just so we could let everybody else know, has a launch for the NOFO been scheduled?
Madam Chair, members of the board, Nikki can respond to that. And then I do also want to comment on the public comment process after Nikki's completed her comments.
Okay, great.
Thank you. Nikki?
Hi, Chair and members of the board. I wanted to let you know that yes, there's a kickoff meeting that begins on September 9th. You can RSVP to Julie or I. And also the timeline is available on MAG's website under homelessness/NOFO. So you can find that information there. And I just wanted to let you all know that the NOFA did come out August 18th and it is due November 16th. And we're meeting with the board chair as well to develop our priority items. Thank you.
Okay, thank you. I just wanted to sort of get that information out there because it happens so fast. Can't really wait till our September meeting to talk about it because we're like almost done at that point, or, you know, we're at least halfway through. So I just wanted folks to know that the NOFO, it's now the NOFO, is out and that things are happening. So please pay attention to that on the MEG website if that's a piece of work that you're interested in. Any other actions or discussion items from members?
Madam
And
Chair?
then I'm sorry, Amy, you had something still.
Yes, I'm happy to defer if any of the board members have any items that they'd like to pose first, and then I can follow up. Perhaps seeing none at this time. The other item, and it's one that we have discussed before as a board, is how to operate these meetings in an inclusive and safe way during the pandemic. We were planning on starting to have in-person meetings, but we pulled back given the increase in the transmission rates. We want to protect the safety of the board and the public as well as our staff. We are offering that if someone would like to participate in this meeting within the Zoom meeting and be able to ask a question or to provide comment as a member of the public, we're happy to do that as long as we have advance notice. We'll provide the Zoom information to them. That isn't something that we're necessarily making available to other committees at MAG that we staff, but we understand the absolute importance to operate these meetings as inclusively as possible, given the safety constraints right now during the pandemic. So if anyone would like to join the meeting in Zoom to be able to make those comments, please do let us know. We're happy to make that accommodation. We're also happy to continue receiving comments in advance of the meeting. And of course, happy to answer any questions that anyone might have before or after meetings as well. Thank you. And if there are additional comments or additional conversation that the board might want to have around how to operate these meetings as inclusively as possible, we'd be happy to include that as a future agenda item as well. Thank you. And Eric, I saw that you took yourself off mute. I wasn't sure if it was in regard to that or something else perhaps. Thank you, Madam Chair.
Thank you. I think that's really good news and a great way to start incorporating folks back in. I know I want to hear from everybody and I want to see their faces too. So thank you for making that accommodation. Eric, did you want to say something?
I just wanted to say thanks for that consideration and for looking into those, ways to make it more accessible because it's so important. So appreciate that.
Me too. Thank you. Okay, I'm not seeing any hands or unmutes. Speak up if you do want to say something before I move on. Okay, moving on to comments from the board. Is there anyone on the board that has an announcement or an event they'd like to highlight? I am not seeing anyone today. I know we have had a long agenda, so I appreciate wanting to get done here on time. So not seeing anything then. With one last check, I'm about to adjourn this meeting. Okay. All right. Well, thank you everybody for coming today. It was a really fruitful meeting. I love this meeting because there's so many awesome things happening in our community right now, and with the urgency that we have, that really is helping everyone, I think, move forward at the type of pace that we'd always like to move forward. Although I don't know how long we can always stand that either, but it's really nice. So thank you everybody for coming and for all the great work that you guys are doing. Please continue to stay engaged and do the tremendous work that you're doing. So with no further business, the meeting's now adjourned. Thanks, everyone.
Thank you.